If you had told me prior to coming into the program that I was going to have both a psychologist and a psychiatrist, and that I'd really enjoy having a psychologist and psychiatrist and trust talking to them, I'd have told you you were high. Like, that's not quite in our DNA to do so. But when you get here, and it speaks to the quality of the professionals that's here, that's also because it's the safe nest, right? If you have other soft folks here, and some of them have been here longer, then as they cycle through, you help each other along, and you poke when necessary. You know, for soft, if we don't want to do something, we dig in pretty hard, and it usually takes some pretty abrasive love to get us to walk down that path. If you were somewhere out there in the medical profession and you were looking to treat soft, much less a group of soft, this is just my probably not so humble opinion, and I'm obviously biased. They're the very, folks I love. It's Never Never Land. It's the home for wayward boys, and we ask our soft people to do a lot, and they're willing to take that on. And part of the process, right, wrong, or indifferent, is to be really thick-skinned. We're going to poke at you or each other to find a weak spot, and we do that, I believe, to you eventually realize that it doesn't matter. Like, if you're somebody who gets upset about those things, soft guys are gonna, is that a scar? And they're gonna pick at it, and they're gonna purposely do so. But it's what we do to each other. But we do that, again, in my 30 years, just to get over it. Your ethnicity, your racial component, your religion, all of that doesn't matter. Your gender or sexual orientation, soft guys don't care. We care about who you are, and that's what you're trying to get to the core of. But in today's politically correct climate, if you don't understand that and you get offended easily, it'll be a rough go. There's a certain mindset that soft guys have, and you need to be comfortable with that, both as a patient and as a provider. And so if you have the right mix, like we have here at Tampa VA, it's absolutely life-saving and career-saving for that matter. I'm still active duty. My personal opinion is anything short of that is fairly disastrous.